rapid access to comprehensive oncology data and survival analysis. This is the OncoToolkit.
Hi everyone, today I saw a patient with ductal carcinoma in situ, or DCIS, following breast-conserving surgery. The surgery went well, but one important question remains. Does she need radiation therapy, or could surgery alone be enough? Let's take a closer look. Our patient is a 52-year-old woman with a 24 millimeter area of DCIS. The closest surgical margin is 4 millimeters. Pathology shows non-high-grade disease with necrosis. Her case is not clearly low risk or high risk, so let's use the USC-VNPI Prognostic Index to support the discussion. We'll begin with tumor size. Her lesion measures 24 millimeters, so we'll select 16 to 40 millimeters, which gives a score of 2. Next is margin width. The closest margin is 4 millimeters, so we'll select 1 to 9 millimeters, giving another score of 2. For pathological classification, the tumor is non-high-grade with necrosis. We'll select this option for a score of 2. Finally, our patient is 52 years old. That places her in the 40 to 60 age group, which also gives a score of 2. Everything is entered. Now let's calculate the score. Here are the results. Her total USC-VNPI score is 8, placing her in the intermediate risk group. According to the reference data, patients in this range may be considered for excision followed by radiation therapy. This result does not replace clinical judgment, but it provides a clear and structured way to bring tumor size, margin width, pathology, and age into the multidisciplinary discussion. If you need to use this result elsewhere, the Copy button lets you copy the assessment as plain text and paste it directly into your own document. You can also enter a patient name and save the result within the platform. Previously saved assessments can be viewed from the Saved Results panel on the right-hand side. To keep all saved records on your own computer, open the Saved Results panel and download them together as a CSV file. If we scroll down, the reference table shows how each score range relates to recurrence risk and the corresponding treatment suggestion. You can also review the clinical context, scoring logic, and primary supporting evidence directly on the page. Thanks for watching. We'll see you in the next OncoToolkit case.